My name is Dr. John Rush. I'm the Chairman, CEO, President, Chief Bottle Washer for Longevity Physicians Insurance Company. I'm also the Chief Operating Officer of Cenegenics, just because I like to stay busy. Also presenting with me today is John Palmer. He's the Vice President of Oceanus Insurance Company. Oceanus does all of the underwriting and reinsurance for Longevity Physicians Insurance Company. And as you all know, it really doesn't matter who insures you until it does. So with that, I would like to turn it over to John Palmer. John and I have worked together. Longevity has been around for, this is our fourth year. I found John and Oceanus in my second year after I made all the mistakes in the first year. And John corrected all those for me, and we've been off to the races ever since. So here is John.
Thank you, Dr. Rush. Today we kind of talk about two specific things regarding professional liability insurance. Last year, I think we had touched on some general aspects of insurance for the physician office, and we're going to focus primarily on professional liability insurance for the individual physician, or physician group for that matter. First and foremost, what do the underwriters consider when they make your rate, when they actually come up with what to charge you? What are the important critical factors the actuaries and the underwriters collaborate on to get to that number? It's not just something that's pulled out of the sky. It's based on that application you fill out, and there are certain areas that have an aspect of increasing or decreasing that rate for you. And then also, what do you need specifically as an age management medical provider? What is it that you need coverage for, or what's available out there? What's the state of the market for that? First, obviously, coverage needs to be secured with the type of coverage form that you would like, either a claims-made form or occurrence form. Interestingly enough, when I was first in the business, I blindly thought that occurrence-based coverage was the best thing that you could possibly have, and come to find out that 95 to 97% of all med mal written on for an individual physician or physician group is written on a claims-made basis. And there's a very good reason why. If you take into consideration two specialties in particular, OBGYN and pediatrics, the age maturation lawsuit, that 18 years out into the future, I have yet to meet a person who is talented enough to predict what lawsuits are going to go for 18 years in the future. Let alone what's going to happen in our business or in healthcare the next 4 or 5 years. It's just extremely difficult. And obviously you're spreading that cost out amongst all the specialties and all the disciplines and trying to do so equitably. But if you're writing on an occurrence basis, that's basically what you're asking your carrier to do. And that's why even the largest carriers in the country primarily write on a claims-made form, even if they offer the occurrence-based cover. It's just simply more efficient.
And I also will say that we, as Longevity, only write claims-made, $1 million, $3 million, except in Virginia. We will get to that in a little bit. But as a younger company, and in insurance terms, 4 years is, that's like we just started yesterday. So we don't have the loss reserves that Oceanus has. That's why we have associated with Oceanus. We can look in the future, because I know a lot of physicians, like John said, because that's what I thought when I first entered medicine, is I bought an occurrence policy because that was the best, and it was way more expensive. So it's kind of like term life and whole life, and very rarely in life is the answer A or Z. It's usually somewhere in between. So claims made, $1 million, $3 million, that's all we write.
Yeah, absolutely. And I think you'll find, the difference between the occurrence approach is nothing wrong with it. It's just a more efficient thing to take a look at your insurance exposure on a year-by-year basis. We're covering things that happened on or after your retroactive date, during the policy term. That's the definition of claims-made coverage. An occurrence takes in consideration a year's premium for anything that can happen in the future up to the statute of limitations in your jurisdiction or the age of maturation, depending upon the specialty. And so it's very difficult to price for that component. The other thing to take into consideration is the appropriate coverage limits. What you want to have for that primarily depends on what your state minimum requirements are, what you feel comfortable with carrying, what lets you sleep at night, and obviously what you're contractually required to carry. A lot of contracts that you'll enter into, they'll specify what they're comfortable with you having, and that's a point of negotiation. Obviously, you want to mirror your individual or group risk tolerance, and they can vary, and there's a rub there. You may feel like that you don't need to carry too much. You can never carry enough, or higher limits simply translate to higher demands and settlements and verdicts. And people fall into one of those two schools. That translates into all the different areas that we have available for excess limits if you need to. The agents are always required to sell you higher limits. If you come to them and ask them, they're going to be required by their E&O carrier to always offer you higher limits because you can never have enough from an insurance agent's perspective. Depending upon your unstable legal environment, if you're in a high specialty severity class, where you're getting a lot of large losses, those could be reasons why you'd want to subscribe to the first example of never carrying enough. And then also the bare bones approach you can take. If you subscribe to the higher limits simply translate to higher demands, you can take deductibles, you can take SIRs, and in some states you can actually go bare, although we don't recommend it.
So that's in Florida.
That's right.
Florida, you can go bare, or we call it going naked.
Yeah.
And physicians in that school of thought say, if I don't have anything and I've put my assets into my home and to my retirement, two things that cannot have a judgment against you, then I'm pretty good. The lawyers won't come after me. Whereas if I have $1 million, $3 million, or $2 million, $6 million, you can be sure that you're going to be sued for that $2 million. There are some studies that show there is a trend to that, but to have at least some insurance, especially for hospital coverage, et cetera, most require $1 million, $3 million. That's
correct. That's the standard that's out there. And that Florida example that you used, when they try to do that, they transfer the assets in their spouse's name. Boy, that's tricky. That can end up not going so well in the long run.
I just put everything in my wife's name, like the day we were married. So that way it just...
There you go.